So it's basic life support. We don't do advanced life support, although we have the capability. What will happen is paramedics, if we have advanced life support patients that are going to move, they'll bring their equipment on board.
I got you.
And work from here. But we do keep mostly basic life support supplies in here. There are heart monitors and things of that nature. We have an ability to, when it's used as a rehab unit, this is used, there's multiple purposes for the use of this truck. One is respond to a mass casualty incident where you can transport multiple victims from a mass casualty incident. Second is as a medical evacuation bus. So if we have to move those patients that have to be moved, evacuated from a facility, we can do that in here. And thirdly, it's used as a rehab unit. So long-term fire scene, major event where somebody has to be rehabbed, relaxed, whatever, we'll do that in this bus as well. And we can monitor multiple patients and evaluate them from a main station here at the front of the bus. So basically, patients will be laid out throughout the bus, and I'll show you how the stations work. Laid out throughout the bus with monitors on them, blood pressure cuffs. We'll be able to check their pulse oximetry, pulse rate, blood pressure, and we'll be able to monitor that centrally from one location at the front of the bus.
Okay.
So
all the electronics are still there.
Yeah, Joey will show you. If you open up the cabinet, there's the electronic units that are used throughout the bus. These are actually military grade patient monitoring systems. And sort of stand up to our people as well.
Pulse oximeter.
Yeah, so pulse oximeter, blood pressure cuff, and then we have, if we have paramedics, we have the ability to do heart monitoring with the ECG leads. And then when this is activated.
Sorry.
Okay, no problem.
So once it's activated, we have the internet set up, the wireless network set up. Then these will transmit back to this station.
And I guess they're constantly charging in the box, right?
Yeah. So when we're in transit, we have 10 of them.
Yes.
I'm sorry. When we're in transit, we have 10 of them. They're always charging. Whenever the bus is plugged in or whenever the generator's on, they're always charging, so they're always ready to go when we arrive on scene.
Excellent.
And the configurations down here, you have a multitude of configurations with the bus. Oh, when you're done. You're done, I'm sorry.
Now, can this transmit to the hospital?
No, this is internal. So basically, it allows us to, when we're driving, we can just see now. This one came up. When we're driving, it allows the person who's sitting here to just be able to monitor 10 patients without having to walk up and down the bus while we're in transit. So this allows us to, we can view individual units, which is what's happening now. You're seeing the individual unit, and then it would display the vital signs, or we can view them. We can view them as a list. If there are multiple units hooked up, then it would show all of them. And we can control everything from here. So we can cycle blood pressures, we can adjust their alarm limits and stuff like that. We can do all from here. So we don't have to walk around on the vehicle while we're driving on the highway.
That's good.
Then you have the multiple configurations that we're talking about. So there's oxygen supply throughout the bus. So all of these are various oxygen outlets throughout the bus. But you have the ability of setting up patients free high, similar to what you have in the back here, where you have a cot on the top, a cot in the middle, and a cot on the bottom. Or for rehab types of situations, you have these seats. So they pull down, they can sit on the seat and be evaluated. Oxygen can be supplied, part of rehab there. Just additional mask supplies, backup oxygen, suction units, and basic supplies for to support the purpose there. And then basically the loading and unloading of patients, which is the most difficult part during a major incident, involve these two cots and a ramp down the back. So typically we'll drop a ramp out the back and then use these cots to ferry patients onto the bus. And then once they're on the bus, we lift the patient into their specific stall for transport.